Hello and welcome to Dr. Nishant's diary. This one's called Misdirection. So, one of my jobs as being in the ICU is shifting patients from the main operation theatre to the ICU. Some of these patients are, what we call unreversed, which is they're not completely out of anesthesia and they have a tube going from their mouth through their lungs through which they breathe, and we're supposed to provide them breaths using an ambu bag while shifting them. It's a short shift, just 2 floors, takes about less than 5 minutes, but I'm supposed to be there just in case something goes wrong. And there was this one patient a couple of days back who was partially reversed in the sense that he was awake, but he was tolerating his tube well, and it was better that the tube remain in place just for his safety. And he was on a T-piece, which is basically just providing him oxygen through a tube that's going directly into his lungs. So on the way, this person, he was a bit drowsy, I thought, but he started moving his hand up till his mouth. And I said, Mr. Patient, I don't like giving names out. Mr. Patient, keep your hand down. We'll take out the tube soon enough. I know it's irritating to the throat. We'll get there and we'll monitor you. And then he started doing it again. And I said, just lie down calmly. I keep doing that. But then he started doing it very vigorously. And I thought, this guy's going to extubate himself. This guy's going to pull out the tube, which can actually cause a lot of problems, especially if you're on the way and you have to rush. So I started rushing this patient fast, and he started getting a bit agitated. And although his eyes were open and he seemed like he's able to understand everything. So I get there, I get to the ICU, and we start monitoring the patient. There are monitors in the ICU, they're really good. And we find his saturation, it's fine. And so we decide, let's just pull out his tube. It's been a while, and let's just pull out his tube. So we did, and the patient coughed, and he started clearing his throat, and he was quite fine actually. Then he suddenly, after a while, when I wasn't around, he told me, I wanted to scratch my nose. And I said, what? So he says, when I was on the way, I wanted to scratch my nose. I was taking my hand up to scratch my nose. Now, the person can't speak when he has a tube in his mouth because his voice box can't be activated. So he couldn't have told us. What he was trying to do was to scratch his nose. He really wanted to scratch his nose. I kept thinking that he was going to pull his tube out. Well, what did I know? And he said, you should have let me scratch my nose. Well, what did I know? So I said, yeah. Okay, so I'll be more careful with patients who are semi-conscious and want to scratch their noses the next time or something. Anyways, misdirection.